RSV, is it really that big of a deal? RSV stands for Respiratory syncytial virus, and it's something that you probably heard about but don't quite understand what it's all about and why it's a big deal. It is a big deal. It's a big deal for seniors and for infants. And I'm going to go through and rely on my notes a lot because there's a lot of data here, and I don't want to just throw stuff out without, making sure I'm saying the right things. But also my blog about dosing schedules, about the different ones, the different vaccines out there, about some references from the CDC. A lot of good information. Don't just take, my flyby here in this 5-minute video. I'm getting this level of protection. So let's first talk about the prevalence of RSV. The most common reason babies under 1 year of age are hospitalized each year. That's a huge thing that we can mitigate and prevent because some of them don't leave the hospital, unfortunately. And RSV and deadly lung infections and pneumonias in adults over 75 get a viral infection with the RSV, and then you get a secondary bacterial infection. And that's where we have 10,000 adult deaths a year in the United States alone, complications from RSV. Hospitalizations, I believe they're talking about there's somewhere upwards of about 160,000 in the United States hospitalized. And they go through and talk about the severity comparison in my blog between RSV, COVID, influenza, and it's pretty interesting. The ones with RSV and unvaccinated COVID patients, they talk about the percentage that had to become met on ventilators and deaths, and the rates are pretty similar. So this one, a lot of people say, COVID's bad, and then they forget about, of course, influenza. They don't even think about that anymore. They should be, because the deaths associated with that sometimes are comparable in unvaccinated flu patients to RSV. Sometimes the numbers are almost the same. So respiratory illnesses that are transmitted by respiratory droplets is a very serious and very virulent, very contagious disease state that we can prevent. And I think a lot of people are missing the boat on this. They really are. Risk factors are, of course, babies. So we like to get them vaccinated. Pregnant women, and usually at 32 or 36 months. And adults with any lung infections, cardiac symptoms, diabetes, very important to get them covered. And especially since it transmits so easily. It's just like COVID, just like the flu. It's got to be taken care of. Seasonal patterns are there with this. Usually highest is going to be expected during October to March, just like the flu. It is a respiratory. It likes to crank up that time of year, I think, because people are inside more. There's a lot of factors, but I think one of the things to look at is get it done in the fall if you can. But sometimes, especially with RSV, there's no real restriction like there is with influenza. Influenza, we have to change that up every year based on what we think the strains are. The same with the new COVID variant vaccine. We change that up every year too. Current recommendations. There's 3 different vaccines out there right now. I'm not going to go over this because it's all in the blog. They're made by the big vaccine companies, Pfizer, GSK, and Moderna. They all have great products out there. Some are approved for pregnant women. Some are approved for babies. And some are approved just for regular patients that are 60 and up. So here's the recommendation. Anybody over 75 years of age really should get it, the vaccine, the RSV vaccine, regardless. And then people that are 60 to 74, if they have underlying conditions, yes, I always have to promote this to people because they say, I want to wait till I'm 75. Well, no, you have heart disease or you have diabetes or you have asthma, you have breathing, you really should get it. And then pregnant women should get it also between 32 and 36 months. Pregnancy from September through January, they really recommend it. Provider, usually it's pretty cut and dry. And I can err on the side of giving the vaccine if somebody's got some medical conditions. And most of the time, especially if they're in a nursing home, sometimes that would be enough of a factor just to do it. So vaccine schedules are out there. Again, best times in the fall, but also the ages is very good. Side effects, very minimal. Usually injection site, sometimes fatigue, tired a little bit. Very few serious effects it's hard for me to pronounce, but Guillain-Barré syndrome, GBS. That's where they have some really nasty paralysis. That is extremely rare with all vaccines, but it does happen. We have to report all this anytime there's a vaccine reaction, so they're monitoring this. They're really keeping a good track on if there's any problems with these vaccines, especially with that one. Then the last thing is I was going to recommend to you is really try to decide when you go to get your flu vaccine, ask your pharmacist or doctor, healthcare provider, to really see what other vaccines you might really think about getting. There's shingles vaccine out there now. There's obviously the flu vaccines. There's Boostrix if you're a grandparent. The whooping cough, that's a DPT, diphtheria, tetanus, and pertussis, the whooping cough. Why not? Side effect profiles are low, and also long-term effects very, very slight. In some patients, they're still trying to find out if some of these really have some of the weight that would make people cautious. Until next video podcast, I'm Rx Healthy Habits. Stay healthy, stay strong, and really think about getting up to date on your vaccinations. God bless.